Hi, thank you for coming to my presentation. My name is Sandra Bedoya Hanson, and I'm a public health advisor for the Field Epidemiology Training Program at the Center for Disease Control and Prevention, CDC. I wish I could have stayed in the camp. These are the words of a woman I met in Western Georgia 5 years ago. She was a Somali refugee who arrived in the U.S. through the Refugee Resettlement Program in April of 2018 at the thick of the so-called Muslim travel ban. Local integration and resettlement to a third country like the US or Canada are part of the durable solutions for refugees, but the thing is that only 2% get the chance to do so, and Ayan was one of them, and she wanted to go back. When I met Ayan, she's been in the country for 6 months, along with 7 members of her family. She was pregnant and struggling to adapt to her new life in America. She wasn't the only one, though. The NGO that was providing counseling service to Ayan at the time reported that 13% of its clients, men and women of all ages, had stated their wishes to go back to the refugee camps where they came from. That 13% is the reason why I wanted to do this leadership project. In the global context of human displacement, the trend is clear. 1 in every 74 people are being forced to flee their places of origin annually. For each refugee that was repatriated or was resettled in 2023, there were 16 new refugees. More people are seeking refuge and asylum, while the policies at the countries of transit and destination are creating more restrictions and requirements. Factors that will continue to challenge the global and local public health stages to respond in appropriate ways and sensitive ways to the needs of a steadily growing population. Ayan was struggling living between two cultures, wanting and needing to hold on to her cultural identity while adapting to a new context and country. When it came to accessing maternal health services, she was facing all sorts of challenges, from lack of transportation to language barriers, insurance costs and processes, intake protocols, limited health literacy, and the fear of racism and discrimination. She was redefining her identity as a mother across cultures to access and utilize maternity services, and for developing coping mechanisms to navigate the health system in the context of the US. As a woman, as a mother, as a public health worker, and as someone who had seen firsthand life in many refugee camps, I wanted to explore from the client's perspective if there was any aspects of the service delivered to pregnant refugee women that could be improved, something that could have made Ayan's experience better. With this in mind, I defined these 3 goals to frame my leadership project. Enhance existing health services and linkages for pregnant refugee women in the Kyrgyzstan community in Georgia, revise and develop healthcare competencies and sensitivities for community volunteers that support health services delivered to refugees, and the development of a framework that will further the involvement of youth community volunteers, especially those with interest in educational and career trajectories in the health sector. How are we getting there? The first phase of the project was gathering information through a literature review and conducting several interviews with the stakeholders, including local NGOs and key members of the Kyrgyzstan community and the Greater Atlanta area, who are often involved in providing health and other services to the refugee community in Kyrgyzstan. In my review, I found very little documentation that spoke of how to factor in the cultural background of refugee women in their medical assessments and treatment plans. A few studies also point out the higher incidence of preventable childbirth complications and poor pregnancy outcomes experienced among refugee women. The studies also highlighted the lack of representation of the refugee population, especially different ethnic groups and of refugee women in maternal studies conducted in the US. However, there is a general anecdotic consensus that resettled refugee women often face multiple barriers accessing and navigating health systems that could be determinant factors in the outcome of their pregnancies. With a better understanding of the context, that second phase of the project focus on deepening the engagement with the community and developing trusting relationships with a group of refugee women. This phase is still ongoing, and I expect it will continue beyond the possibility of implementation of the project, as I have connections to the community that means a lot to me. I have attended Refugee Council meetings, gone on hikes, tea parties, done yoga, and art classes led by Refugee Women Network, the NGO partner that I was looking to engage for the project. We're currently on the third phase, reviewing the competencies for RWN volunteer programs. We're also working on developing new competencies for potential youth volunteers, those who might be interested in having a career in the health sector. What's next? While the project offers a local perspective, it also adds to the global efforts for the proper integration of resettled individuals in a country like the US. I hope the project could be a platform to continue the conversation around culturally comprehensive services for pregnant refugee women, an opportunity for enhancing the service delivered to pregnant refugee women, and for pivoting those services and lessons learned to the larger community. I hope it continues to encourage and support advocacy for the refugee community to access quality care that is equal and meaningful. And I hope it will allow the leveraging of partnerships within the public health sector and among of those who want to support local integration for resettled individuals. We have come to the closing of the chapter for the WomenLift, with ups and downs, but through all it, I have had the support, encouragement, and coaching of many wonderful people. From the person who nominated me to the program, to my family, colleagues, and friends, and of course, the amazing group of women in this cohort. To all of you, thank you.